Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Iron deficiency anemia, that is IDA, and we are looking at its causes. So, what is the main cause of the IDA? So, if we look at the causes of the IDA, it includes the dietary lack. So, IDA may be due to the dietary lack, that is, the infants who are at high risk due to a very small amounts of iron in the milk. So, it may be due to the infants, and they are at high risk because of very low amount of iron, because of decreased amount of iron in the milk. And the human breast milk, it provides up to only about 0.3 mg per liter of iron. So the human breast milk, so the breast milk, it provides up to 0.3 mg per liter of iron. And then the impoverished, who can have the suboptimal diets. So in terms of the impoverished who have the suboptimal diets. So there is suboptimal diet, who have suboptimal diet. So this is for the socio-economical reasons at any age. So it can be due to the socio-economical region. Then in terms of older adults who have the restricted diet with little meat. So who have the restricted diet, and this restricted diet is with little meat, along with little meat, and this is because of the limited income and the poor dentition. So it is associated with the limited income or the poor dentition. Next is under the dietary lack, it may be due to the teenager. So due to the main reasons being the teenagers who subsist on the junk food, who are dependent on the junk food. Next, we move on to the impaired absorption. So how does the impairment of the absorption take place? So impairment of the absorption, this is due to the sprue. So it may be due to the sprue, as well as it may be due to the gastrectomy. So gastrectomy, it is by the Billroth 2 procedure. Next, we move on to the increased requirements. So in what condition does the increased requirement happens? So in terms of increased requirements, so here in terms of increased requirements, there is a growing infants. So in terms of the growing of the infants. Next is the children. So growing of the infants, or it can be the children. Then comes the presence of the adolescents. So it may be due to the increased requirements in the adults, the infants, children, and the adolescents. Next is in terms of the premenopausal women. So they can be in premenopausal women, particularly during the pregnancy. So it may be due to the pregnancy. Next is, where do we have? There has in terms of the economically deprived women. So in terms of the economically deprived women. So this woman, they have a multiple closely spaced pregnancies, are at exceptionally high risk. So in terms of the multiple, so they have multiple as well as closely spaced pregnancies. Closely spaced pregnancies, they are at high risk. They are at very high risk. Next is, lastly, in terms of the causes of iron deficiency anemia, is the chronic blood loss. So in terms of the chronic blood loss, so here by chronic blood loss, we refer to the menorrhagia. So it may be due to the menorrhagia. Next is, it may be due to the carcinoma of the cecum, as well as the hookworm infestation. So they can be due to the hookworm infestation. To learn and grow daily like this, please do subscribe.